What is the future of medicine? What will medical education, research, and patient care look like 50 or 150 years from now? To predict the future, it's helpful to reflect on the past. And for the University of Iowa, Roy J. and Lucille A. Carver College of Medicine, the story begins in 1870 with the first medical school class on the university campus in Iowa City. Medical training through the University of Iowa can be traced to 1850, when the Iowa legislature sanctioned the College of the Physicians and Surgeons in Keokuk, located some 90 miles away, as the university's affiliated medical department. But the fall of 1870 marked the true beginning of medical education at Iowa. The university's Board of Trustees set fees at $5 for enrollment, $80 for lectures, and $30 for graduation. The medical department opened to students of both sexes, making Iowa the first coeducational medical school west of the Mississippi River. 8 of the 37 students in the first class were women. The medical department began with one building, South Hall, located next to the old Capitol on what is now the University of Iowa Pentecrest, was renovated to include an amphitheater with room for lectures and clinical demonstrations. The curriculum covered surgery, anatomy, obstetrics, chemistry, medicinal substances, and the theory and practice of medicine. Over its first 2 decades, the medical department grew steadily. A second medical building, known as the Mechanics Academy, was added for clinical instruction in 1871. The facility was both a teaching hospital and a charity care facility, with nursing services provided by a contingent from the Sisters of Mercy of Davenport, Iowa. When the Sisters opened their own hospital in the mid-1880s, the medical school faculty provided care for patients. In 1898, a new university hospital, built specifically for clinical instruction, replaced the old Mechanics Academy building. The turn of the 20th century brought fundamental changes to medical education. A 1910 report of the country's 155 medical schools by educator Abraham Flexner sparked a national reform movement and spurred public and private support for the University of Iowa's Medical College. The completion of a new university hospital in 1928, which followed the construction several years earlier of a state psychiatric hospital and a children's hospital, ensured an influx of patients and clinical teaching opportunities. Following the completion of the Medical Laboratories building in 1926, the new hospital firmly established a burgeoning medical campus in Iowa City, west of the Iowa River and the main university. The 1930s saw Iowa medical faculty producing important original research, such as the role of vitamin K in blood clotting factors. The Department of Pediatrics established itself as a major national site for studies on infant nutrition and metabolism, and advances in blood transfusion at Iowa led to the establishment in 1939 of one of the nation's first blood banking systems. The post-World War II years marked a boom in government funding at the nation's academic medical centers. Federally supported research and training initiatives focused on cancer, cardiovascular disease, and psychiatry, which were among the most well-established programs at Iowa. The General Clinic Research Center, formed in the late 1960s, greatly expanded human subjects research at Iowa. The Cardiovascular Research Center, established in 1974, was another blossoming research enterprise that yielded important findings related to cardiovascular regulation, hypertension, and vascular biology. Growth continued throughout the 1970s, 80s, and 90s across the College of Medicine and University of Iowa hospitals and clinics. A shift towards specialization in undergraduate and graduate medical education reflected an interdisciplinary, research-oriented approach. Over the same period, the college also established programs aimed at preparing future generations of family physicians and other primary care providers to become part of Iowa's healthcare workforce. research and patient care programs brought greater national recognition to Iowa. Basic science and clinical advances in blinding eye diseases, cancer, cystic fibrosis, genetics, heart disease, muscular dystrophy, neurology and neurosurgery, orthopedics, otolaryngology, psychiatry, and surgery, among others, helped strengthen the College of Medicine's reputation as a center of innovation and discovery. The past 2 decades have marked a new era of medicine at Iowa through generous private support, new buildings and facilities, collaboration and outreach across Iowa, and a new curriculum for medical education in the 21st century. A lot has happened in the 150 years since the first medical class at the University of Iowa. Admitting 8 female students in the college's very first medical student class was impressive for its era. Today, women represent half of the college's student body. The medical department faculty in 1870 were a small group of primarily generalist physicians, and most were non-residents who traveled to Iowa City each week. Today, the majority of the college's 1,300-plus faculty are recognized as leaders in education, basic sciences and clinical trials, and medical specialties and subspecialties. Medical research in the late 19th century was fledgling at best, and a relatively low number of clinical cases for teaching purposes was a challenge for Iowa's medical department in 1870. Today, the research enterprise is a hallmark of the college, garnering over $245 million in external funding in fiscal year 2020, including nearly $139 million from the National Institutes of Health. And through UI hospitals and clinics and collaborations with providers and health systems across the state, clinical education is central to teaching and training resident and fellow physicians, as well as students in MD, physician assistant, physical therapy, and other degree programs in the college. As it has for the past century and a half, the Carver College of Medicine stands ready through its mission of biomedical research, medical education, and patient care and service to serve Iowa and the world well into the future.